What flu symptoms in children warrant a doctor's visit? When your child comes down with the flu, it can be worrying, but knowing when to seek medical help is key. Some symptoms are signs that your child needs prompt evaluation by a healthcare professional. If your child develops a high fever that lasts more than a few days or reaches 103 degrees Fahrenheit or higher, it's time to call the doctor. Persistent fever can signal a more serious infection or complication. Difficulty breathing, such as rapid or labored breathing, or if your child is having trouble catching their breath, requires immediate attention. Watch for bluish lips or face, which can indicate that the child isn't getting enough oxygen and needs urgent care. Severe or ongoing vomiting or diarrhea can lead to dehydration, especially in young children, so if your child cannot keep fluids down or shows signs of dehydration like dry mouth, no tears when crying, or significantly fewer wet diapers, see a healthcare provider quickly. A cough that worsens or interferes with eating, drinking, or sleeping is another warning sign. Lethargy, extreme tiredness, or if your child is unresponsive or difficult to wake, are serious symptoms that need urgent medical evaluation. Persistent pain or pressure in the chest or abdomen, seizures, or convulsions are signs of severe illness that requiring immediate medical attention. Neurological symptoms such as sudden weakness, confusion, or difficulty with muscle movements, especially in children with existing neurologic conditions, should not be ignored. Ear pain or drainage from the ear might indicate a secondary infection like an ear infection, which also warrants a visit. Children under 2 years old are at higher risk for complications from the flu, so any flu symptoms in infants should prompt a prompt visit to the doctor. Children with chronic health conditions such as asthma, neurologic disorders, or weakened immune systems need close monitoring and should see a healthcare provider as soon as flu symptoms appear. While most healthy children with mild symptoms can be managed at home with rest, fluids, and fever reducers, any worsening symptoms or emergency signs mean immediate medical care is essential. Early evaluation is especially important because antiviral medications are most effective when started within the first 48 hours of symptoms. If you notice any of these warning signs, contact your child's healthcare provider promptly to discuss testing or treatment options. Remember, every child is different, and when in doubt, it's always best to seek professional medical advice to ensure your child gets the care they need to recover safely.